because they're being told to go to a doctor that is educated with a mantra are safe and effective. That's all they've learned in their medical education, except also they're told what to say to an a doctor told me that it's actually in their exam. So you're allowed to use these labels. It's completely unscientific, and yet at the same time they're calling this evidence-based medicine. This is the deception we're operating against. And they're even deceiving you with the word immunization. They're calling a program an immunization program. That's you assuming that you're getting immunity from a drug that they're injecting into you. So you're already believing that it's good because it's an immunization program. Because they've never been proven to prevent the disease, and many of them don't actually create immunity in individuals. So it's again, it's fraudulent promotion of a drug. Natural immunity. We were born with immune systems that need to be naturally primed by the environment. In fact, doctors knew, in our generation that an individual's immune system won't work efficiently if it's not primed naturally. So that's another important point that parents need to recognize. Injecting foreign material, that's viruses, attenuated viruses and bacteria, injecting them into the body is quite different to ingesting them through your airways naturally. You've got lots of, the first line of defense includes, all the mucus and the cilia that prevent these bacteria and viruses getting into the body and into the digestive system and stomach. But no, you're injecting the foreign protein of a virus or bacteria with toxins, and I will tell you, antibiotics. The majority of childhood have antibiotics in them. And many people these days know how antibiotics affect the microbiome of the stomach. And that causes, autism and many other things. People need to just be told those very simple facts about how our body defends itself, and that our natural immune system, the best time to be primed naturally is actually between the ages of 1 and 13, before your adolescence. Between that time, they know that the child's immune system is the most robust it will ever be, therefore, and you can be exposed to these viruses and bacteria, and you'll only get a mild case of the disease, you see. The serious cases are the ones which are hospitalized and die. And they knew that by 1950, all of the childhood diseases, the serious cases, had been reduced completely to almost negligible, to the point where the government said doctors no longer need to notify the government of measles, whooping cough, influenza. All of these diseases were taken off the National Notifiable Disease List in 1950. And that was whooping cough as well. Parents were not worried after that time because they knew expose the child at that age, over the age of 1, under the age of adolescence, and your child will get a very mild or asymptomatic infection. Right? Asymptomatic does mean no symptoms, but you're not a risk to other people. That was the lie that got told in 2020. The pharmaceutical companies again took natural science and reversed it and said that you are now a risk to other people. I mean, Mark, people are carrying thousands of viruses and bacteria all the time. We're never a risk to each other. It's the having a balanced ecosystem and good hygiene, sanitation, that healthy ecosystem that keeps it all in balance. And all of those things have been lost from people's education, and the doctors are never educated with it. That was the other thing. The doctors are never educated with the history of how we controlled infectious diseases, all of them, by 1950. And that's why anybody in 2020 who knew all that stuff, you're not going to get a pandemic in a developed country. It's clearly all manufactured. And getting back to the point I made earlier, when I found out that the Australian government is no longer designing our own policy, it is coming directly from the World Health Organization, where private-public partnerships, including the pharmaceutical companies, are directing all these so that every country has the same program, developing countries and developed. That's absolutely contrary to Public Health 101. You know, you need to design public health policy for the environmental conditions of your own country. It varies. And that's where someone like Bill Gates, who's directing this whole thing, he's got no education in, you know, public health or any health at all. And he's influencing global policies through the Gavi Alliance. You know, this is the fraud we're dealing with.